Okay, we do have 3 presenters for the next talk. So we've already heard Dr. Howard Ralph's bio, so I won't read his again, but I will read our next 2 presenters. Dr. Hayley Stannard is a senior lecturer in animal anatomy and physiology at Charles Sturt University. She's an animal physiologist with expertise in mammalian biology and physiology and specific expertise in marsupials. A lot of words in that one. Dr. Stannard's research supports animal conservation efforts in Australia. Her research answers fundamental questions such as how animals obtain and utilise scarce and diminishing resources to survive and reproduce successfully, and how interactions with pathogens in the environment affect animal health. So we can welcome Dr. Hayley Stannard to the stage. And Mary Wynan is Director of the Wombat Protection Society of Australia and a Senior Veterinary Nurse at the renowned Southern Cross Wildlife Care Hospital. Marie has dedicated her life to the well-being and protection of wildlife. With over 3 decades of experience, Marie's expertise and compassion have made a significant impact in the realm of wildlife rehabilitation. She's the co-founder and operator of, I hope I'm pronouncing, Jarake Wildlife Sanctuary, a sanctuary that focuses on the preservation of wombats and macropods, with a particular emphasis on treating mange, which is a debilitating condition affecting wombats.
Thank you. I'll just start first by doing our acknowledgement to country. We would like to acknowledge the lands in which we work and live and where we did this work. So in Garigo land and in Wiradjuri land, where I live and work, is where we did this. So we'd like to pay our respects to the elders past, present and emerging, and any Indigenous people that are with us today in the room and online. So thank you to the organising committee for allowing us to come and talk about this. It's a very important topic, very close to our hearts, and it's what we do every day. And just a small warning, there is a pretty graphic picture of mange. It's a pretty visually confronting thing when they have really severe mange. So just one small warning, one small picture. So I'll hand over to Marie to give us a bit of background about where this project started and where it ended up and why we did it all.
I'm going to go with this one, I think. And how do I do this? Next and back. Hi, everybody. Okay. Starting with a little video just to make everybody really itchy. Sarcoptic mange is a mite infestation affecting many species, including humans. The mite digs into the epidermis, causing intense itching and inflammation. In wombats, it will lead to their death unless they are being treated. Wombats are susceptible to mange due to many factors, including environmental stresses. We often see an increase after, for example, land clearing, drought, fire, and flood, and it is a highly infectious disease. Wombat Protection Society have been treating mange in wombats for nearly 3 decades and have been using very large doses of Moxidectin for the past 15 years. One of our first cases was an adult male with severe mange. He had open wounds, maggots, and he smelt of mange and infection. He was laying down and didn't even get up when he was approached. Believing he was about to die, it was thought euthanasia was the best option. But when you're only armed with a bottle of Sudectin and being in a remote paddock, a desperate decision was made to give him a very large dose of Sudectin to kill as many mites as possible, mainly to protect the other wombats in the area. My husband and I went out the following few days, but we couldn't find him, so we assumed that he had died. Then, 9 days later, as we were setting up a population scale treatment in that area, I found him standing by the creek, drinking water, looking much better, scabs falling off, maggots gone. So we kept going with the treatment and he ended up making a full recovery. We were still hesitant to use those very large doses until we had another difficult case. A male wombat that during the first 3.5 years, he was given between 20 and 30 ml doses, and during that time he was never mange-free, but continued to have various degree of mange. We were then concerned the mites were building up resistance to the Moxidectin, so therefore, after the 3.5 years, he was given between 80 and 100 ml doses weekly for 16 continuous weeks. He spent the following 6 years mange-free and healthy. Then in March 2020, he was found with a large swelling on the side of his face, and he was taken to wildlife veterinary surgeon, Dr. Howard Ralph, of course, for assessment and treatment. He, the wombat, not Howard, received, or maybe both, received a physical examination, and tests included full hematology and comprehensive biochemistry. It was confirmed that his liver, kidneys, and other organs were healthy, and his presented teeth issues were unrelated to having had mange or mange treatment. We treated many cases, but were only discussing this locally. Others soon followed with the same success rate, and our anecdotal database increased. The wombat in the picture is showing before and after treatment is another case successfully treated by one of our members. The product we use is Moxidectin with the active ingredient Moxidectin. It's a macrocyclic lactone endectocide derived from a Streptomyces bacteria that was isolated in 1983 from a sample of sand from Victoria in Australia. It has been widely used in veterinary practice for the treatment of mange infestations in livestock, companion animals, and wildlife, but no one had, until now, assessed Moxidectin levels in plasma, feces, or hair or bare-nosed wombats after a pour-on application. I missed some there, didn't I? Let's go back. We applied and received APA minor use permit, allowing for 4 ml per kilo, up to 100 ml for 5 doses, 5 to 7 days apart, based on case studies and published data of the safety of Moxidectin. We decided to go more public, including on social media, to reach more people who could help more wombats, but we weren't very successful at delivering the message as treaters wanted scientific proof. This is a very short summary that led Wombat Protection Society, Drake Wildlife Sanctuary, Southern Cross Wildlife Care Hospital, and Charles Sturt University to undertake pharmacokinetics of Moxidectin in bare-nosed wombats. So that is the product we're using, and then the project. So our number one priority was the welfare of the wombats. Therefore, no wombats were chased, trapped, or harassed. We trialed Moxidectin on 11 free-living wombats to test pharmacokinetics, specifically looking at absorption and excretion. Plasma, hematology, blood chemistry, and fur samples were taken pre-treatment and then on day 1, 7, 14, 21, and 28 after the treatment. Scat samples were opportunistically collected before and after treatment. The first wombat was given a 50 ml dose, and as no blood values or physical changes were observed, we continued with 9 wombats receiving 1 dose of 100 ml. 2 wombats had mange, and they received 3 doses of 100 ml per dose, 7 days apart, and both made a full recovery. One of these wombats was then used again 7 months after he recovered from mange. So in the field, we searched for the wombats by walking through the paddocks and forests covering 4 different wombat territories. When the correct wombat was found, we did a quick mental note of all the nearby burrows to estimate the wombat's preferred getaway. A couple of wombats, including this one, would feed on a supplement pellet that made life a little bit easier for us. An intramuscular injection of Zolotil was given in the femoral muscle by quietly sneaking up on them and then backing off and waited until the sedation took effect. So this wombat has just had his injection and I'm just backing off and waiting. Sometimes we used a net to cover the closest burrow in case the wombat would take off trying to escape into the burrow after the injection was given, but before the sedation had taken effect. But this is how most of them reacted. They simply were doing their normal things and then just quietly laying down. So when they were sedated, we placed the wombat on a stretcher and then onto our electric eco buggy to take the wombat back to our facilities. And we had a very curious observer wondering what we were doing.
What are we?
So we monitor heart rate, oxygen saturation and respiration rate until they recovered. Blood and fur samples were collected, they were weighed on a digital platform scale, and a small section of fur was clipped for identification. We cleaned and treated wounds, cuts, abrasions and bite marks, and physical observations were also made daily. Hematology and biochemistry were analysed and results printed within 15 minutes of drawing the blood from the wombats. The plasma, faeces and fur were kept at -20 degrees until it was analysed. Faeces were also checked for other parasites, both via a smear and a fecal flotation. And after the last samples were collected and when we were finished with them, they received 1 dose of toltazuril and 1 dose of fenbendazole. As with sedation, the recovery is different for each wombat and each time. A couple of wombats kept dropping their head and wanted to pace, so we tried to protect the head with a helmet, but abandoned that idea immediately, and instead the simplest way was to just hold them up until they could control their head. As soon as they were alert, we took them back to where we rudely interrupted their daily activities. We stayed with them for a couple of hours to make sure that no other wombats gave them a hard time and until they could fend for themselves. If they went down a burrow, we would guard the entrance to make sure that they were left alone. Collecting scat samples turned out to be harder than what we expected. No problem finding wombat faeces, but to confirm the pellets were from the correct wombat was a challenge. First, they didn't want to poo when we were watching them. Then, after following them for hours, they could go up and do a wee on top of an old poo belonging to someone else. We had decided that we must see the pellets actually dropping out of the wombat or it wasn't a valid sample. The pellets were placed in a Ziploc bag, still steaming, with a small portion saved for the microscope and the rest stored at -20.
Here we go. Rock. No, butt scratch. Marking. A bit of everything. Territory marking. Not a bit of a scratch. But, yep, you leave me with nothing. Thanks. Mr. Tree here, yes. Look at that. LBOT. Thank you.
So this is one of the two that had mange, showing a close-up of the fast recovery time on one of his affected areas. So he was treated with 3 doses over 2 weeks on day 1, 7 and 14, and he both of them made a full recovery. And that is him 7 months later. And Howard, that is.
Okay, thank you. Carrying on from that wonderful work, the thing that we needed to do was then analyse all the samples we got, and the haematology and biochemistry came to my lap. The thing that we need to think about is what do we do with it, how do we interpret it? And if you look through the literature with all species, including humans, there is a general range of what's a normal level for both haematology and biochemical analysis of any kind. Even things that we're familiar with, we've been doing for a long time, there is generally a range, not a single number. And with wildlife, we have the problem because we don't have a sample, often we don't have a sample of many hundreds, that the range of normality reported varies quite a lot in one report and another. So we have to put that into some sort of context and think about looking at the the numbers that we get from any individual, such as the ones we've been treating, and then interpret that in the normal wombat and look for any change that might occur. So we're looking, just because Marie's already talked about the process, but the whole point of this study was to apply some scientific rigour to the welfare of wombats, which is what we're all interested in, of course, and all other species. But in this case, there was a problem because mange was such a terrible disease. We needed to try to get as much information as we could and perhaps push the limits a little bit to improve the outcome, which has always been a bit problematic with sarcoptic mange. And so we end up with this poor fellow that ultimately ended up with quite a good outcome. Sometimes we need a small, brave human to go and retrieve the patient. And this applies not only for this treatment, but all other treatments. All right, at Southern Cross, we treat lots of wombats, and Marie's mentioned one or two of them. Some of them, of course, are non-compliant, such as this character who was demanding to read the clinical notes. And so we let him have a look at them. He consumed a little bit of it, but we kept most of it. And the main motivation, as I said, was to look into a scientific way of providing an animal welfare improved state for the treatment of a terrible disease, which was sarcoptic mange. And they were treated as you saw, and we collected a lot of data. This is sort of part of the printout that we get for every wombat with full hematology. There are many, many numbers in this and full biochemistry of all sorts of things, which are, some of which are more relevant than others. But what we're particularly interested in is what change has occurred in any of these parameters, particularly looking at the ones that might indicate there is some toxic effect of the medication that we're giving. We always have to be aware of toxicity developing, and so we look very carefully at all these numbers as soon as we can. Sometimes we find there's a change in numbers that we weren't expecting, but as Marie already said, the wombats are all fine when we started, and as a footnote, of course, they're all fine when we finished. But in the meantime, we did check things like fecal samples and flotation and all the other things that Marie mentioned. And some of them, of course, had other problems at the time, which became apparent, or some became apparent with the hematology, which was the main thing that changed. The biochemistry, there was very little change in any wombat. There was certainly no evidence of liver damage or renal damage or other major changes occurring in the biochemistry. So all the changes that we saw were in the hematology, which is all of these many, many different white cells and red cells and all the parameters that tell us if there is a change and why is that so. If there is a change, of course, we need to interpret that in the light of clinical examination, and interpreting those changes is the remit of clinical medicine. So that's where I came in, to look at all these numbers and see if there was anything that needed to be changed. In particular, did we need to stop the trial because something was going wrong? And really, there was no major change in the biochemistry, but some of the hematology did change. And most of the changes that we saw in the white cell count and occasionally the red cell count all occurred around about day 7. Hayley's going to go through all of this in great detail, but looking at the plasma levels of Moxidectin around about day 7 at the second blood test in most of them, the changes mostly coincided with that. However, a lot of the changes were already present. And what happened was that changes that were already present before the trial ended up changing a little, but then settling back to what was the pre-trial number. For example, Alfie was one that had a very high white cell count right at the outset, higher than normal. And during the trial, we noticed that the second test at the day, around about day 7, that number went up quite high, but it then dropped back again to what was the pre-testing dose level. The lymphocytes were quite high as well. They went up as well, and then they dropped back to the normal level. The eosinophils were another white cell which we look at in terms of why is it changing, and it did change. It was reasonably high to begin. It went up further around about day 7, and then it settled back down again. But we know that in the case of Alfie, that Alfie had lots of strongyloides, and this may have been the reason why it changed, although we wonder whether there's something going on other than that with, if there were mange mites, if they were releasing antigen, which was causing this change to occur. Midnight was another one, and there were the white cell count went up a little, not particularly high, but it did change, and it was once again around about day 7. Eosinophils went up to a high level at day 7 and then dropped back again. So it was the same pattern developing in these things. Midnight had quite a low hemoglobin. In other words, he was anemic. I'd better hurry, I'm late as usual. Hemoglobin was low, and we know that Midnight had quite a significant load of coccidia, so that may account for his anemia. His sodium level was low, it went up a little and then dropped back to that. And so these changes were not really massive, but they were indicating that something was happening. But in all those wombats, they remained clinically well. There was no clinical change of a problem, and the biochemistry remained fairly stable. So there was really no evidence of toxicity. I was going to talk about all the different white cells and what they do, but the most important one, I guess, is the eosinophils, which change according to parasite load and allergic response and some other rare conditions. The problem is that it's inconsistent. And we often find in clinical medicine that we get a patient that's got a high parasite load, but the eosinophil level doesn't change. So it's not totally reliable. It's more so in humans and dogs. They're much more reliable in lots of ways. But in this case, the eosinophil count in wombats really is not a very good guide. But it did change. It went back to the normal level thereafter. We think about stress. Stress is always present, but the thing about this trial, we avoided the stress, and you saw the lovely induction that occurred in Marie's capable hands. And the thing to keep in mind is that the medication we use has got 2 benefits. One is that it's a very good smooth induction sedative, and the second thing is, which is why it's so good in wombats, is that it's a retrograde amnestic drug, which means that they forget what happened before you gave them an injection. And this occurs in all species, whether it's humans or dogs. So it's a really good thing for wildlife because they don't remember the fact that you sneaked up when they're trying to have a dinner and stuck them with a needle. So it's a very good thing to do in terms of stress. This trial, and when Hayley goes through some of the other results, it showed us that this is a very valuable addition to what we understand about what is an effective treatment for sarcoptic mange in wombats. Stress we mentioned, they're not obviously stressed, and thank you very much as usual.
Managed to keep him to time. Okay, so I'll do all the boring sciencey stuff, okay? So we took the plasma samples, we spun down the plasma and took it off and took it over to Charles Sturt Uni to have it analysed by my colleague, who is another collaborator on this project, Greg Doran. He's a chemist, and he'd never worked with Moxidectin before, but I have never seen anyone get so excited about a chemical in my life. If you want to know anything about the chemistry of Moxidectin, I will point you in the direction of that man. He got so excited. He did so much exciting stuff in the lab with the liquid chromatography and told me all about it, and I couldn't repeat it for you. It was fantastic stuff. So what we found is that we got a peak 7 days after they were treated with the 100 mils of Moxidectin, and the peak was, on average, it was 0.5 nanograms per mil of plasma, which was really great. There's quite a lot of variation between individuals, because we did give them a 100 ml dose, no matter what their body mass was. So their actual dose rate is quite different. So they ranged from 12.8 to 19.6 milligrams of Moxidectin per kilo of body weight. So there is a bit of variation there. And as you would expect, if they got a higher dose, they have a higher peak. So not unexpected, but this very nice low number was absolutely fantastic, because there's only one other pharmacokinetic study that has been done, and it's been done in the southern hairy nose wombat, and it's subcutaneous injection. And they only injected 0.2 milligrams per kilogram of Moxidectin, so a much, much smaller dose than we gave, but they had much, much higher levels in the blood, because obviously they're directing it straight into the bloodstream. So they're going to have a very high peak before it teeters off. So it was really good that ours showed that, you know, there's not as much crossing into the bloodstream. It's staying on the surface of the skin and it's acting directly on the mites, which is fantastic because that's where we want it to work. So our mean retention time was 12.85 days. And when we compare that to the southern hairy nose wombat study, theirs was much shorter, 5.8 days, because it's being cycled through the blood. It's going through the physiological process of being processed by the liver, but also excreted. So in our 2 infected animals, we gave them 3 doses of 100 mils each day. So on this, where it's circled is where they were dosed. So you'll notice that there's a day 14 and a day 13. You can't tell a wombat to come back definitely on day 14. It showed up on day 13, so it got treated on day 13, which was great. But the interesting thing about this is, even though we gave 3 100 ml doses, the peak was much, much lower than our 9 control animals. So we only got a mean peak of 0.25. So half of what we got in our other animals, which was really good. Again, it's showing that it's acting on the skin, on the mites. And fortunately enough, these guys had no live mites after the first 2 treatments. So on that middle day, we've got no more live mites, and that was really, really great. So we managed to cure them, and you saw the pictures that Marie put up before of the healing wounds, really fantastic. So it's really good to be able to do this stuff and do it in the field with some pour-on doses, because that's how wildlife carers are using Moxidectin in the field. So next we have the scats. So this is where the chemistry got really, really exciting, because when you got poo, you've got lots of other things in there. You got the microbes from the gut, you got the plant material, so it had to get a lot of extraction processes and cleaning before we could actually look at the Moxidectin. So there was a lot of steps that Greg had to go through to spin this all down and get it like this, and got him very excited about animal poo. Chemist excited about animal poo. I'm winning as a biologist. So we did it on a wet matter basis, but we also do it on a dry matter basis just to compare weight for weight value. And we get that peak 1 day after. And I don't think that's 1 day after. I think that's 4 days after, isn't it? 3 days. So it's about 3,555 nanograms per gram of dry feces. So you get that initial peak, but at second, it's still pretty high, and then it goes down. Wombats have really long gut retention times, depending on how much fibre is in their diet. So it's from about 32 to 56 hours. So it takes quite a long time to clear their gut. So you get a couple of other peaks a little bit further on, because you sort of get this bulk movement of food through their digestive tract. In my other part of my life, I'm a nutritionist as well, so ask me about animal nutrition anytime. In our hair samples, we get that peak 1 day after, similar to our plasma. So it's on the hair in a peak, and then it tapers off towards the end. So really good things that we found is that we're having relatively low levels go across into the plasma, which is great because we're pouring it on the outside. If you do it as a subcutaneous injection, it needs to move across the skin and across tissue to get out to the outside, because the mites are feeding on the lymphatic fluid that is in the epidermis. It has a lower half-life but longer retention time than the subcutaneous injections that's been done in the southern hairy nose wombats. The peak excretion occurred on 4 days, because I can't read the graph on the other. Sorry, everyone, 4 days. And, you know, those mange infected animals had lower concentrations, and those 3 treatments, no live mites after those 2 weeks, which was really fantastic. So we were able to cure them, which is really great. So hopefully moving forward, we've got all this to sort of send off to APVMA to really support that we can use these high doses to treat mange in animals when needed. So Just lastly, I'll do a quick plug. I am on the board of the Australian Wildlife Society, and they sponsored me to come here and present today, so thank you very much to them. But as a society, we give out a Wildlife Rehabilitation Award every year, so please consider nominating yourself for that award. The prize is $5,000, but at any other time, if there's any other conservation-related things that you're doing, which I know you all do, if you need a small grant, you know, usually $5,000 or less is easy for us to fund. There's an application form on the website. You put it in at any time if you need funds. We're happy to support you. We are here to support the work that you guys do. So reach out anytime. And if you want any research done, reach out to me at Charles Sturt University and anywhere, WPSA. I'm wearing many hats today. So thanks for your time.